Good evening, friends. What we refer to as exfoliation syndrome or exfoliation glaucoma was first described way back in 1917 by Lindbergh. Since then, the disease has manifested in its various manifestations, and we have got to understand the condition more. And today, this syndrome may be defined as an age-related generalized disorder of the extracellular matrix, characterized by the production and progressive accumulation of a fibrillar extracellular material in tissues throughout the anterior segment and also in connective tissue portions of various visceral organs, and is the most common identified cause of open-angle glaucoma worldwide. So as I just mentioned, it involves the eye in a very diffuse manner, including the anterior segment as well as the extrabulbar tissue, as well as have involvement in systemic locations, particularly the visceral organs. We are concerned about ophthalmic manifestations, mainly in glaucoma, but at the same time, we must remember that patients with exfoliation syndrome play an important role in the management of cataract because of certain pathology that is associated with this disorder. These patients have poor mydriasis, an extended blood aqueous barrier breakdown, endothelial decompensation, retinal venous occlusions, usually associated with homocystinuria. And whenever I get a patient with exfoliation syndrome or exfoliation glaucoma, I make it a point to have the patient refer to the internist so that a proper cardiovascular and cerebrovascular workup is done. As regards etiology, about 40% of the patients with exfoliation syndrome will develop glaucoma eventually. And coming from the other perspective, about 20% to 25% of patients with open-angle glaucoma worldwide will have exfoliation syndrome. The study done in Shankar Netralaya showed that urban population had a lower prevalence than the rural population in terms of developing, showing exfoliation syndrome. And ocular hypertension increased the risk of these patients developing, going into the glaucoma stage. As regards the mechanism, open-angle glaucoma, open-angle mechanism is more important. There is the final common pathway is increased outflow resistance in the trabecular meshwork because of the cellular dysfunction at the trabecular cell level, trabecular meshwork blockage by the exogenous or endogenous exfoliation material, blockage by the iris pigment, and increased aqueous protein concentration. Angle closure mechanism is less common, and it is usually associated with progressive zonular weakness, increasing lens thickness, increasing adhesiveness of the iris to the lens anterocapsule of the lens, so on and so forth. Relative anterior microphthalmos is also quite commonly seen in these patients. Now, as regards the course of glaucoma, as I just mentioned, that exfoliative material is a risk factor for glaucoma, and EMDT showed that ocular hypertension patients with exfoliation syndrome is like 2 times more likely to go on to develop glaucoma than patients without exfoliation syndrome. This kind of glaucoma is a very highly progressive nature, represented a higher IOP. The diurnal IOP variation is much more. So if you see this particular curve, the upper curve is the patients with exfoliation glaucoma, and it has a very rapid and very steep curve, very rapid progression. So probability of developing glaucomatous optic neuropathy is higher in eyes with exfoliation glaucoma than other forms of glaucoma, same eye levels. The glaucomatous neuroretinal dim damage tends to be more diffuse with exfoliation glaucoma as opposed to the sectorial preference in primary open-angle glaucoma. Differential diagnosis in a true capsular delamination, primary amyloidosis, pigment dispersion. As regards treatment, all medical, lasers, and surgical treatment have been found to be useful to treat different stages of the condition. Many of these patients, treatment should be begun early, but many of these patients eventually go on to surgical therapy requirement. Now, I would start off the patient with a bimatoprost. There are studies showing that it is better than many other prostaglandin analogs. I would have a lower target IOP and ask them to come back for a more frequent follow-up situation. And if I have to step up therapy, then I would use a combination of prostaglandin analog and timolol in these patients. The SLT is effective in both exfoliation glaucoma as well as primary open-angle glaucoma, and in a more or less similar manner. And SLT and ALT both have more or less similar role to play in exfoliation glaucoma. In patients with occludable angles, if patient has cataract, of course, patient goes for cataract extraction. Otherwise, EAC-PI definitely helps. And these are the surgical options. I have experience in doing trabeculectomy for these patients. The surgical technique is basically routine. Mitomycin C is used routinely for all these patients. And post-operatively, these patients are put on topical steroids for a longer period of time. Many of these patients have combined them with cataract surgery, and that's a different thing altogether. This is a study which was published last year, which compared the various surgical management strategies in patients with exfoliative glaucoma, and it concluded that there are several trials, but there is insufficient evidence to determine whether any particular surgical or laser technique is superior to another. So in conclusion, exfoliation syndrome is seen about 3% to 6% of the population. Urban population had lower prevalence. It is seen overall 40% of patients with exfoliation syndrome will go on to develop glaucoma. An estimated 20% to 25% of the patients with open-angle glaucoma worldwide have exfoliation syndrome. Once glaucoma is present, it is much more aggressive, generally with poorer prognosis, and patients will require multiple medications, and frequently this is escalated to surgical management. At present, we don't have sufficient evidence to determine whether any particular surgical or laser technique is superior to another. And proper patient counseling as regards the various systemic issues and surgical outcomes is very, very important. Thank you very much.